there will be presentations from the people at this table, and Mr. Lidico will introduce them all to you. And then after the presentations are completed, there'll be a chance for people in the audience to make statements and ask questions. And we have microphones here. This room is pretty large and there are quite a few people here. The acoustics are awkward because of the cement floor, so if I could just remind you all, when you speak at the lectern here, using the microphone, please put it close to your mouth so that everybody has a chance to hear your thoughts and questions. And if at some point you're in the audience and you cannot hear a comment made from the table or from others in the audience, would you please raise your hand, and that'll be a signal to me to ask the person to either speak louder or to repeat the question or the comment. First about me, I am not related to the hospital in any way. I'm a business owner here in town, and I've only lived in Lakeview for 6 years. I'm not quite sure what motivated the board to ask me to be their moderator tonight, but I can assure you I'm a neutral party. I have my own thoughts, just like everybody here. These are important questions, and I think this is an important meeting. But please try and keep your emotions, and if you have any anger, keep them moderated, because the whole point of the meeting is to listen to information that people here will share with you, and then to share your information and your questions. And this meeting will be very successful if we're able to do that in a civil, calm way. So I get it that there's some strong feelings. Let's try and have a very successful meeting, and I'll try and help you make that work. When you come up to answer questions at the end, we will ask you to keep your comments to 3 minutes. And the reason is we don't have an unlimited amount of time. And there are a lot of people here, and many of you may wish to speak, and I'm sure the board and management want to hear from as many of you as possible. When you speak, please first introduce yourself. Just give your name and an address. It's a public meeting that's being recorded, and that's the protocol that's required by the state law that governs the state body. And also, because we're asking you to hold your questions till the end, sometimes it's helpful when you're hearing things from the presenters. You might have a question or a thought that you're saving and that you would like to ask at the end, and the best way to remember that and to get it down is to write yourself a note. And toward that end, we have some pencils and cards at the front and some on the table by the door in the back. So please make yourself comfortable to grab a pencil and a card so you can write down your question and you can remember all the questions and comments that you have. I would also ask you please to remember to turn your phone off and your ringer so that we can all focus on what's being said in this room rather than to third parties. With that, I'd like to introduce Don Lidico. He's the chairman of the board of Lake County District, and he's got some comments.
Thank you, Mike. Thank you, Mike, for graciously accepting our request to be an impartial moderator for this meeting. Welcome all to everyone here at the meeting tonight. I see many friends, neighbors, clients, and others here. And it's great to have everybody here for a board meeting. I've never seen this many at any of our other board meetings. So, we hope that you will learn to understand the Is that better?
Yes.
No?
I tried this.
Turn up the speaker.
Oh, here, I can do it like this. See things. I got it. Here, I'll just do it.
You're all here. We hope that you will learn to understand the difficult challenges that we have. There's been a lot of stuff going around in the community, and we hope to clear these things up. My hope is that you will be more informed and that you will be supportive of our actions here that are efforts to Since I came on the board in 2008, the Gordon Inslee years as he was CEO, the Lake LTC, the long-term care facilities, and health and hospice have traditionally not been money makers, but have been supported by much of the property tax revenue.
Yeah, you don't have to talk louder.
It's all the way up.
Yeah, cut. Right in your mouth.
The mic is as hot as it's going to get. I'll try to be a little bit better with the so, how's that? Okay, sorry about that. Okay. Well, I hope that you learn to understand we have difficult decisions that we have made and the challenges that we have. When I got on the board in 2008, long-term care facility ran at a loss. The loss was more than covered by the property taxes that you folks pay. Since that time, we have had losses as long as we've been here. The loss this coming year will be $2 million in the Lake County facilities there, and our property tax revenue collection is going down. Red Rock went bankrupt, and the property tax that the community now pays doesn't even come close to covering the operating loss that long-term care alone has.
Could you speak up, please?
Okay. We are now faced with some undeniable facts. Chronic and ongoing Medicare underfunding. Medicare does not cover, it does not come even close to covering our costs. The increasing unfunded government mandates. We are mandated to have certain credentialing, certain salaries, and certain nursing and traveling costs. Those things are expensive, and we are under pressure there to cover even just the staffing costs. We are having problems finding qualified staff. Now, this is part of the governmental mandates. We've got to have qualified staff. It's difficult to find and attract people into Lake County, Oregon. Our state representatives and our federal representatives have failed to address the problem. They have, this last session, abandoned efforts that we have been trying to get to achieve greater funding, and those are not coming from the state nor the federal coffers. So we have to look to ourselves to take care of ourselves. These all things come together with creating unsustainable losses into the known future that we have. Our projections are not good. Our district, this district is not alone in this conundrum. If you recall, in 2021, Prineville closed their long-term care facility. In addition, if you will look on the back there, we have printed out a Lund report that shows that there were the 2 facilities in Tillamook County that closed because of lack of funding. And there are other facilities around the state that are closing as we speak. The American Health Care Association, in the information provided there, shows what our national problem is, as well as our local problem. It is funding, salaries, and the ongoing federal mandates that we've got. There's another brochure back there on Save the Seniors Act. I would urge all of you to look at that and take this to our local legislators and our state legislators to see what we can do about achieving greater funding. But it's difficult. These things are going to take time, and time is of the essence here. We cannot continue to afford to pay traveling nurses the way we are doing to keep these facilities alive. The bottom line is that these closures are necessary so that we can continue to have a hospital in this community that we deserve and expect. Another issue is the state mandated use of the behavioral health funds. These have been granted to the county, and the behavioral health is a county function. It's a separate function from the hospital. I'd like to make that point. The state government is trying to create more help for focus on substance abuse and homelessness. So those funds are completely separate from the hospital, although we do take care of that for the county under county contract.
Can you speak up, please?
After the meeting, I hope you will agree that we are all committed to providing the best care. Yes.
It's not louder, speaking louder, it's just a little closer.
You have to.
Okay. Yep. Thank you. After the meeting, I hope you agree that we are all committed to providing the best service we can with the resources that we have in our facility at this time. Now I'm going to turn the mic over to John Shine, and then John has a few prepared comments as well. Thank you.
Can you hear me now? Yes. All right. Lake County has 3 crown jewels: the ski hill, the Daily Collins McDonald Scholarship, and our hospital. When I joined the health district 4 years ago, I was told that Lakeview Gardens never makes money. It loses about $1 million a year, but we get about $1 million a year in our tax base. So the board's job is to make sure we're doing well at the hospital. COVID was hard on the hospital finances. The hospital makes money on tests, MRIs, CAT scans, x-rays, etc., lab work, pharmacy. During the worst of COVID, we could not do these, and yet everyone was still getting paid, and the losses from services kept adding up. We had our fair share of cash reserves prior to COVID. We had about 80 days of cash, which means if we stopped getting revenue, it would be the number of days it would take for us to run out of money. Lake Health District is a critical access hospital. As such, we receive cost-based reimbursement for our patients who are on Medicare and Medicaid. About 65 to 70% of our business is paid by Medicare and Medicaid, and we get reimbursed for those costs about 18 months later. We do not get cost-based reimbursement on our long-term care business because it is paid by the state. Long-term care losses this year are approaching $2.5 million. Most of the long-term care residents are on Medicaid, and we can bill Medicaid whatever we want, but they pay whatever they want. Medicaid pays about half our cost in the long-term care unit. We have used up our cash cushion. We are now at 15 to 20 days of cash. If we don't make changes, we will run out of money. These are difficult choices, and they have big impacts on our community. At the core of what we do at the is we run a hospital, an emergency room, a health clinic, an emergency medical service, or ambulance. We must protect these functions. We need to pare back other areas that are not making money. It creates hard choices, but we must protect our core functions. Tonight, we want to candidly explain how we got here and why we are making these difficult choices. And with that, I'll turn it over to Gerald.
I'm Gerald Stewart. I'm the secretary of the board. I've been on the board for 10 years. And I've had the privilege of living and raising my family in this community. And I'm also thankful that I live in a country where we have the ability to assemble and we have the ability to speak what we think. Together, we face many challenges, and we're trying as hard as we can to provide quality care, quote, close to home. And tonight, we ask for your insight and your suggestions, because we're all in this together. And I hope that tonight we can disagree without being disagreeable. Thank you.
Thank you, Gerald. I'd like to take the time now to introduce Charlie Twait, our administrator, our chief executive officer, and he's come with a few prepared comments as well. Charlie?
Well, I get to fill in a little bit more. Can you hear me all right? Fill in a little bit more on some of the issues that our board members have talked about. I think there's a couple things that we need to all understand, and you've heard this said by several. Yes, we're a critical access hospital. That means we are 25 beds. We're more than 35 miles from the next nearest hospital. That's important because of that cost-based reimbursement. Now, it's not 100% of our cost. It's about, Congress keeps whittling it down, and it's about 94, 95%. Long-term care is the responsibility of the state. And so it's paid for by state dollars. So when we look at how do we operate a long-term care facility, we try to do that as efficiently as we can. When we look at how we provide services in the hospital, we try to provide as efficiently the services as we can, but we also have to keep in mind the importance of traveling and going elsewhere. Since all of these people have been on the board, and since I've been here, we've tried really hard to bring more services to Lake County. Why do we do that? Because every one of us that needs care, if we don't deliver it at the hospital, you have to drive 90 miles to Klamath, 200 miles to Bend or to Medford. That's expensive, it's difficult, and frankly what happens is a lot of people don't go. And so when you show up, you're sicker. We are very fortunate to have extraordinary physicians and mid-level practitioners. We're very blessed. That's not the same in other communities. But when we think about long-term care, we think about how we get paid for it. One of the drivers of cost for everything we do in healthcare is the staff we employ. And we have fabulous staff. But since COVID, and everyone says, oh, there's lots of money from COVID. Yeah, well, since COVID, a lot of things have changed. During COVID, we couldn't hire enough people. We couldn't hire enough nurses. We couldn't hire enough CNAs. And so we began to rely more and more on travelers. Why do we do that? Because we have to keep everything open. Patients need care 24/7. When travelers were coming, and we've had travelers for a long time, but during COVID, the demand for their services became so great. The companies that were giving us these temporary workers were charging us 2 and 3 times the normal rate. 2 and 3 times. But when you have no choice, we had to do that. In Oregon, the state, understanding that hospitals were struggling to try and find staff, actually went to FEMA. And for the first time, FEMA, the people that deal with hurricanes and tornadoes, gave money to the state to help us pay for those travelers. Well, COVID ended. And so did that money. But those travelers, people that we relied on, they're not from this community. And they don't want to come here. They like where they're at, and they like the traveling way of life. And the prices barely came down. They've come down a little bit. But now it's only twice what it cost us, 2.5 times. Now that means that we are paying significantly more money. And the money does not come more from the state. So people are saying, oh, gee, well, the state gives us lots of money. Yeah, they did until we had this extraordinary cost in travelers. We tried last year to eliminate travelers. And we made that as a concerted effort. But then another thing happens, and this happens to all of us. People get sick, or they move. Somebody's relative or their family member or their partner decides to leave the area, and off goes a great nurse. and we couldn't operate without traffic. Put it in perspective, we need right now 12 nurses in our acute unit. 12. That means we don't manufacture them. And trying to convince nurses to come here is as difficult as it is to try and find more practitioners. Our doctors are getting older. We need to plan on how we are going to find doctors to come in and do what they do. And the biggest challenge we face with finding new doctors, the new doctors, 99% want to work for a clinic, not be like Dr. Graham, who is a businessman and runs his own clinic. 1% of all doctors that are graduating from medical school and residency want to do what he does. And he looks at it, he talks to me and says, you know, this is really hard to do. And it is. Another thing, we're not finding people that want to come to rural settings. And that's not here, it's the entire country. So we're having a hard time finding people that want to work in healthcare. And when we do find them, the cost is extraordinary. That's the biggest problem with long-term care. When we think about the next issue that we're dealing with, and that's home health and hospice. You know, we didn't have hospice for a long time, or home health. And I think about 20 years ago, it got started up again, and Lisa Cahill was the first director when we started that back up. That was a long time ago, many of you remember that. I'm sure Lisa remembers it. We have struggled ever to make that financially viable. And so the hospital, the health district, has supported that. Our problem now is that we can't find enough nurses. The same problem. COVID was devastating on our workforce. Not everybody understands this, but we have nurses that have been quitting and retiring. They've gotten burned out. Physicians, nurse practitioners have gotten burned out. They have worked like the dickens to take care of us. And they're tired of it. And they don't want to work this hard. And it is difficult. And how do we encourage them to come? Well, we can't find nurses to work in our home health and hospice. So we have to think about what are possible solutions. And I've heard many people say, oh, well, let's try foster care. Well, that's a great solution. We have people that want to do that. I was approached by Collins McDonald Foundation yesterday, who said, we really want to help. We know this is a difficult situation. We want to change from what we've done in the past, which has been, they've been very gracious and have helped us buy equipment. That's really important. And they said, we'd like to help, and we'd like to help with dollars. My problem is, how do I find staff? It's hard to find nurses to do this. But we're still going to pursue that, and we're going to try that. One of the things that Don talked about is a legislative solution. Now, it's hard. One of the things we want to think about, we're not the only rural hospital in a rural state. Lots of states have rural communities. The state of California and the state of Alaska are very rural, have portions of their state that are very rural. In those states, they have legislative agreement that if a critical access hospital has a long-term care attached facility, so it doesn't have to physically be attached as part of their business, then that cost-based reimbursement gets spread from the hospital to the long-term care facility. That has enabled the communities in Alaska and in California that are small, like Lakeview, to be able to keep a long-term care facility. We've been working hard with our legislators to try and get something like that done. Representative Owens, Senator Findley have been working with me, and we talked to the other side, the Ds, about this, and we thought we had a reasonably good option of getting that solution. And then our legislature couldn't talk to each other for 6 weeks. That meant that this wouldn't happen. What the state has said is it's possible for the 25-27 biennium, but not for the next biennium. That's really disappointing, and it's really frustrating. How do we find other solutions? We're talking about not only a lot of money, but we also have to find staff. We have wonderful people that work in our long-term care and assisted living. And my heart goes out to the hard work that they do to care for our community. How do we find more of it? We're putting on training classes for CNAs. And we've done that time and time again. CNA, in case anybody doesn't know, is a hard job. It's a really hard job. And so a lot of people get into that. They want to go into nursing, but it's still a hard job to do. So finding people that want to do that is our unquestionably our biggest challenge. I want to just address a question that has come up. Don talked a little bit about it, and that is, oh, we're going to buy the Hereford, and how dumb is that? Does anybody voice that concern? Probably. Just about everybody. So let's talk a little bit about that so you understand how that works. So, number one, the health district contracted with the county to provide mental health services. They've also contracted with the county to provide public health services. Those are contracts. So when our great state approved the purchasing of recreational marijuana, part of the agreement was that we would tax those people that want to buy it legally. The illegal, that's probably a much bigger portion, they don't pay any tax. But those that buy it legally, those tax dollars are defined in the M110 law. And those dollars have to be used throughout the state to help with substance use disorder, people that have become addicted to some drug, and then we have to be able to help them deal with that addiction. The state decided to give $100 million to be spread throughout every county. Of that $100 million, we received $233,000. $1,233,000. That money can only be used for a couple things. Number one, we have to acquire a location. We can't build something, we can only buy, rent, or renovate. Number two, in that location, we have to provide a sober environment and a place where people that have addictions can go to and stay safe, sober, and then, as happens with this terrible addiction, is that people often ruin their lives or harm their lives. And so we have to help them re-establish themselves and work on rebuilding their lives. Those are the requirements. Not only that, we have to spend the money in this upcoming biennium. When we talked about where we could do that as a location, we looked at every building that was possible in Lake County, but predominantly in Lakeview. And we felt, and I recommended to the board, that if we're going to use that money, we ought to use it to help our community. I went to the state and asked that we take that $1.2 million and of that take 850 of it and use it toward a building so that we could purchase a building and remodel it to those purposes. If we did that, any idea how many buildings there are available in the community here that we could actually make as a safe, sober environment? Not very many, maybe 5 or 6. So at the bottom line, that's the reason we made I made the recommendation, the board agreed that the Hereford building would be the building to work with. And for those of you that have been listening to this, big concern was, what is the cost of the roof? Well, we have gotten some cost estimates. We have not purchased it, so anybody that thinks we purchased it, it's not true. We're in the process. The reason we haven't purchased it is because the state mandates that when we acquire a building, that we agree to provide substance use disorder treatment, either in that location or in another location, should that change, for the next 20 years. When we talked with the commissioners about that, they all said, we're in the business of providing mental health services in Lake County, and there's no reason that we will not continue doing that for the next 20 years. That's the commitment. So that's the reason I have recommended to the board, and the board agreed to that. We have one more grant that we haven't even talked about, but we want to get talking about. There was a little discussion last night about a property that the Veterans Administration, or Veterans Office, is talking about, where Kogart has some property off of Roberta. We were granted $1,487,000 specifically to buy permanent housing to support people that have substance use disorder. Now understand, listen please, understand, that was part of the $100 million tranche. That's the total amount of money that the legislature allocated for every county in Oregon. That's our portion. So when we have to provide that service, we haven't found locations, we have to get after that, because that's a requirement of what we have to do for our community. And every county is doing the same thing. So we could say, well, we'll just give it back to the state. They don't want the money back. They want us to provide that service. And those are the challenges that we face. Now, I talked a little bit, but I'd like to allow people to ask questions so that we can try and respond. So, Mike, how would you like to have that?
So we'll have make sure the mic works first. You can hear me at the back? Yeah. So we'll have the microphone up here. If you have questions or comments to be made, please feel free to come up to the podium. Yes, ma'am. Okay, so just come up to the podium. You can be in line. I'll monitor your time and give you a signal about 3 minutes.
Very great, 1982 Highway 140. Glad you brought up that Hertford building. How in the world do you think $850,000 is any way going to renovate that building? You might get a roof on it for $300,000, $400,000. But the floors, it's a steel building, so they're going to need seismic retrofit. That is a money hit, plain and simple. That's a lot of gunshots.
If I could answer that?
Sure.
So, there's no question about it, that building needs a lot of work. No question. So the important thing that we looked at, first off, there was a study done within the last year by an engineering firm to look at what could be done to fix that building. And what they said is, number one, it needs to have the roof fixed. And yes, the roof can be fixed. We don't have enough money to fix the building. I have no intention of doing it. And I've never recommended it. What we have enough money to do is to fix the building. That cuts down the damage that's caused because of a bad roof and water damage. What we can do is you work on the ground floor. Now, let me finish. We don't have to renovate the entire building. All we have to do, and those of you that remember, behavioral health was located in this building about 15 years ago. Ken, if I have the time right?
That's right.
Is that correct?
That's right.
So it was about 15 years ago.
Yeah, I would consider that second floor. Are you considering that first floor?
I'm considering the ground floor,
Yeah, I mean, where the businesses are, or the next floor up, street level?
the street level, not the
Yeah,
second
mental
floor.
health was on the second floor.
So,
Then go upstairs and get in there.
well, sir, you're right. There were some offices on the second floor. I would not with this is not enough money to do all that.
I just think you're probably a $5 to $10 million money pit. That's my opinion of it. And if there's been water running into that thing for 30 years, so then you end up with a mold issue, or like say a seismic retrofit, you're talking even more money. It's just a money pit. It's got money pit written all over it, and that's my opinion.
Hello, I'm Barb Martell. Can you guys hear me back there? No. Can you hear me now? Okay, first off, before I start my 3 minutes, I want to give our long-term care employees a huge shout out because they bust their butts for our family and they are amazing people. Questions for the board members. I'm going to individually call on board members to ask questions. My first question is about Brownsfield report from the hospital, lateral structure report. John, do you have any information on that for me?
Not with me tonight, but I have seen the report.
Okay, and what was in that report, if you don't mind sharing it with the audience?
Well, I was an engineer that went through the building about, I think it came out last fall, and it talked about the...
John, we can't hear you. Can't hear a word.
It was an engineering report that was done last fall that pointed out deficiencies in the building and what they predicted the problems were, and it was a pretty thorough report, probably about 78 pages long.
And what were their findings on it, if you don't mind me asking?
The roof needed to be replaced.
Okay.
And
go on ahead.
I don't know what specifics you're being.
Okay, so what about asbestos, black mold, electrical reports? Are there any reports on that? Any estimates on the cost of what all that will cost to repair and get taken care of?
Not that I'm aware of. In that report, there was no cost estimates.
So there's no estimates right now. What about engineers? Is there any engineer on this? On this particular Hereford building, and have you had an engineer come in at all?
Well, I guess Daryl Anderson has been there, but I don't know. You have to ask Charlie. I don't know the answer to that.
All right. Okay. So another question, and it's about double checking balance for a CEO with finances. Do anybody have anybody that backs the CEO checking finances or any balances or anything like that? Do you have a double checker?
We have an accounting firm that does a annual audit,
And does the board have access to those financial assessments before a CEO?
yes. I think we get them at the same time, actually.
Okay, exactly how much property does the hospital own or lease?
Are you still directing these questions at me?
Yes, I am.
I don't have that list here, but we own numerous pieces of commercial property in town and several residences in town.
Okay.
Margaret, 3 minutes, so.
Okay, I wish I had more time. I have a lot more.
I yield my time to Barb.
Keep going.
Keep going? Okay. Okay, well, another question I have that I'm very interested in is, why did your financial person leave? I think it was about 2 or 3 years ago you had a financial person leave. Can you give me an answer on that one? John?
Well, my understanding is Cheryl took a job up in Lake Chelan, Washington.
The comment that I heard from her directly was that she was in fear of Charlie spending and her fear of losing her license. So that was a comment that I had been given. Long-term care, the decision to close it down, was that a closed meeting? Or was it an open board meeting that you had that decision made?
We had a work session about 2 weeks ago.
Okay. What are the 8 topics legally permitted in an executive work session? Do you have the answers to that? Because if not, I have it on my phone.
No, I do not.
I have it on my phone. And I can read them off if you guys have a minute for that. Okay. So, I'm probably gonna have to cut off the video. Sorry, guys. Let me see if I can't get it up here. Give me just a second, sorry to do that. Okay. So, we're in the work session on an executive topics legally permitted in an executive session, closed to public attendance. Number one. Number one, employment of public officers, employees, or agents. Number two, discipline action of public office or employees. Number three, performance evaluation of a public office employee. Number four, labor negotiations. Number five, real property transactions, consideration of exempt public records. Number seven, consultation with legal counsel regarding legal stuff. I had to break it down. Sorry, you guys, I'm a little nervous talking in front of all you guys. And number eight, closing and discontinuing a public service does not qualify as an executive session. So legally, you having a secret meeting about closing long-term care was not legal. It should have been an open public meeting at a public board meeting. So, was there a public meeting on it? And what was it? Did anybody? There was no public meeting. Can we go back and find that public meeting on it? So,
Barb, you're at 6 minutes now, so.
I yield my time to Barb.
Yeah, hold on. I don't think yielding time is going to help people who are standing behind Barb. So why don't we allow people to do their 3 minutes and then have another question or speaker, and you can certainly speak again, Barb. There's no reason why not.
I'll yield to let these guys ask.
Yeah, let's just circulate so we get more things. Thank you.
Absolutely. Thank you, guys.
Hi, I'm Cindy Lamb. Okay, I'm Cindy Lamb, and I used to work at the hospital. I started in '76, and I worked there several times. Started in the kitchen, went to unit secretary, and went to the business office as a builder. And as far as the billing goes, I can tell you they do have a definite problem. I had a procedure done back in November. It was paid in December. I got a bill yesterday for it. Why does it take that long for a bill to go out to a patient? And I also had an ambulance last year, never did get billed for it. And there is always a balance for Medicare patients on ambulance billing.
So I can answer the question about billing. I'm sorry that the billing has not gone out correctly. We made a decision several years ago to change from the CPSI software that we had been using to Cerner. Cerner is there are two of the main software systems in the United States, Epic and Cerner. And we have struggled to make the Epic or the Cerner software work correctly. Unfortunately for us, it didn't help that when we did the install, it was in the middle of COVID. No one can hear me? Okay. Well, yes, COVID is over, but getting the software to work has been difficult. I apologize for that. We are working very hard to make that system work better.
Okay, how often do you guys use your surgical department? Years ago, they did all kinds of surgeries, TNAs, cholecystectomies, gallbladder, which is a cholecystectomy. Like I said, I'm not a public speaker, so I'm kind of nervous about this. appendectomies, C-sections. You guys don't do hardly any of those at this facility anymore. Everyone has to go out of town for major surgery.
Well, I'm sorry that you have that opinion. Dr. Chang and Dr. Bradbury would differ in that view. We do a number of surgeries at the hospital.
There's a lot that I know people have been sent out of town to go have surgeries. A lot.
And
Including myself.
one of the reasons why a lot of people still have to go out of town is because we are not capable of taking care of people with certain kinds of conditions. And that's the reality of what we do.
But they did for years. They did for years. We have less population here now, and it takes you 3 months to get into a doctor. 3 months. And you don't want to go into the walk-in clinic for everything because you want to see your doctor who treats you all the time. That's like just going to the emergency room. You see somebody different, they don't know you, they don't know anything about you, they don't know what you're being treated for. And when you don't feel good, you don't want to have to go through your whole life history of what's going on with you. And that's routinely. Most everybody in this town, I'm sure, it takes them 2 to 3 months to get into a doctor. And we have way less population than we did before.
Here, 4 minutes, thank you.
That's fine, thank you.
Thanks, Cindy.
No, just go back.
My name is Susan Old.
A little bit louder.
Susan Old, 250 South F Street. On October 27, 2021, my husband was diagnosed with pancreatic cancer. 17 days later, he died. In those 17 days, home health and hospice got us through. I didn't know what to do. I didn't know what to do. Home health and hospice came to my home and helped me, and helped us, helped our entire family. For over a year after my husband passed, someone from hospice came to my home once a week to give me grief counseling. What happens to all the people who have tragedies in their lives now that you've decided that hospice isn't worth the money? What happens to those people? Charlie?
I'm sorry, I didn't know if you were still talking, so I was waiting. I'm very sorry for your loss. We have a couple of options on how we can deal with home visits and, to a degree, some of the hospice care. Because we have a rural health clinic, we are allowed by Medicare rules to do home visits. It is not the same as home health, but it is a similar way that we can send a nurse from the clinic to provide home services. We won't be able to provide CNA services that is available through home health. We also will be able to provide some hospice services through the hospital at the end of days. But it is not as good as the agency service. It's a tragedy that we are unable.
It's a tragedy that the hospital is so mismanaged financially that you have to cut services for sick people and old people. It's a tragedy.
That's the way it is run.
My name is Nick Card. I actually work at the hospital, and I have 2 questions. How many jobs are being reduced by closing these 3 facilities?
So the answer to that is, it's hard to say because many of the employees that can be brought into work in the hospital or in the clinic or some other area, we will try all we can to get them into positions. Not everybody has the same skills.
Let me rephrase it then. How many people are currently employed by those three services?
It's about 30 employees, 35.
And how many openings of CNA level or without requirements for college or licensing are open at the hospital?
I don't know that off the top of my head.
Okay.
Josie Ferry, and Mary's
He's right about there.
Josie Ferry. Okay, this is one of my first meetings. I just have some friends in the long-term healthcare, and I'm like, it's really hard to explain to them that they have to find a new place to live, and they say, I have no place to go. And I'm like, I get that. And they're crying, and they have no place to go. They're 80-some years old. We have a very nice facility. I have a stepdad that's in the Alturas one, and I would love to move in here. Is it correct we have 36 residents in what we did?
It would hold 36.
It would hold 36. We have not had that. We currently have 9 residents in our assisted living and 15 in long-term care.
But there's 3 houses, right?
So that's combined.
So how many are in the, because the Lily house is full.
So in the 2 houses that are long-term care, there are 15.
Lily and Lila.
Yes.
So there's 12 in Lily.
So that means that there are 3 in Lila.
And only 3 in Lila. And then how many are in the Plum?
There are 9. Now that was as of, yes, that,
That's completely incorrect, Charlie.
so what is the number?
Houses. Yeah. Lilac is long-term care and so is Plum. Lilac currently has 10.
has 6.
And I would say Plum has 5 at this point. We have one that's going home. So.
Just leaving.
Yep, and then the assisted
One's that
living
are
has 10 currently, which is Lily House.
Okay, so what you're trying, before everybody started leaving, because they had a 30-day notice, and they got a letter, they got a letter that said 30 days. So I'm talking to 2 people, they were told on the phone they had 60 days, but they got a letter saying they had 30 days to get there. And it was, yeah, and it was very, not very, they weren't very happy with their letter. And so, and then you said that, they got it yesterday. But anyways, you said that 50% of Medicare is what is paid back to, for the long-term care residents, that you get about 50% of what's billed. And on your little sheet, it says 86%.
About 50% of our cost, what it costs us to do it.
And right here on the financial brief, it says 86% of Medicaid only is reimbursed as part of actual nursing home care. So,
could I answer something about that?
yeah.
So all of you that have seen the paper that we have in the back, and we are happy to send that to you. It's all online. This is the National Long-Term Care Association information. There are a lot of things that, the reason we're providing this is because this is a problem that our country is facing. There have been over 450 long-term care facilities in the United States since 2020 that have closed. And the reason they've closed is, number 1, they're not getting paid enough. Number 2, there aren't enough employees to do the work. And unfortunately, rural communities suffer more than urban environments. No question about it.
Okay,
And that's what that material is about.
Okay, I would agree with all of that, and I am only trying to help the home health care people because I think it's, I want to kick rocks right now that we are closing this for people in this community and stuff. So say you have 30 residents, that is sometimes a little bit of guaranteed money, right? That you have coming in, because you have that many people already paying you, correct? And you have,
If we have 30 people that are, where we have residents that we are getting paid,
yeah,
that is income coming in.
okay. And so why would you close something that you know you've got some money coming in on where you're not getting money other places you might not get it?
So for those that didn't hear the question, did everyone hear the question? Why would we close it if we're getting money? But you have to remember, we have to pay the cost to deliver the care.
Okay, and so you put part of that as traveling nurses, and when I'm there, I know everybody there. There's not a traveling nurse in long-term care.
Well, I'm sorry, but that may be the case. But
I
we
know
remember-
every single person there.
we also are responsible to provide service 24 hours a day, 7 days a week.
I get that a lot, more than you know.
So we have 4.5 minutes now. So
Okay, well then,
try to wrap it up.
no, I'm just asking this question, why
Did you get an answer?
Well, no, I didn't on that. I mean, I know we keep going through COVID and we keep going that we have to provide money, but, then going back to the buildings where we have to provide a safe and sober environment, what are you gonna do with those 3 lovely buildings? I mean, if you have 3 lovely buildings that are 30 lots and why can't you put a safe and sober environment there? I can't do it at all. Sorry, I've taken my time.
Hi, I'm Robin Callahan, and I will.
I'd like to say something to that. You know, I could bore you guys to death with looking at the audited financial statements that we present every year and the financial information we receive at every board meeting. I'd love to see some of you there.
Can't hear you.
I'd love to see some of you there at our board meetings when we're receiving financial information and our audited reports. I've gone back to 2016 on the audited reports for how much money long-term care and adult care grosses for us every year. In 2021, our net patient revenue was $3,328,000. Our wages were $3,712,000. Wages exceeded revenue. So we had a loss. How did we make up the loss? A good portion of that loss is made up by property tax revenue. Property tax revenue is going down. In 2022, we made $3,297,000 net revenue. We spent $4,822,000 in wages. Of that, $2,805,000 was traveling nurses and professional fees. It's unsustainable. We cannot continue to spend the money the way we're spending the money. Where's it going? It's going into wages. It's going into traveling nurses. It's an unsustainable system that we have going. And a lot of it is out of our control with the way the state and federal governments reimburse us. We are reimbursed not nearly as much as our costs. And that's the fact. It is not something we're making up. And you can go back to the audited reports in the last 10 years and see the losses that we have incurred.
Before you speak, Robin, Don, I think there was one question that the last speaker asked that didn't get answered. And if I understood it correctly, and please correct me if I'm wrong, the question was, I think, could be, if we cannot afford to pay the costs of care in the long-term care facility, could we not use the money that came for the Hereford building to to buy or to renovate the long-term care in order to provide the safe and sober living environment. Is that a possibility? And did I get that question right?
Yes.
Was that the question?
Well, sort of, yeah, that was perfect.
I guess what's your plans for the future use of those Lakeview Gardens? That's a big part of that.
So a big part of that, the question is, what will we do with those buildings? It is our goal to see if we can get our legislature to change the rules on how to pay for long-term care. There are 3 hospitals in Oregon that are critical access that have long-term care. All the other communities that have a critical access hospital, either they don't have long-term care in the community or it's provided by an outside company. The other hospital that is operating a long-term care facility is in John Day. Anybody ever been to Prairie City? You know where that long-term care facility is. The hospital in Reedsport, there is a long-term care facility that is, as I understand it, leased to an operating company out of Portland. If we can get the legislature to change the financing arrangements so that we actually get paid what our costs are, what the state has said to me is they would love to have us reopen, and they would see no reason we couldn't do it. The problem is, how do we get it now? And we don't have a solution. And that's...
But you're paying a bond off. There's still bonds on those places. You're paying the bonds off. You're gonna have to use them for some kind of income generation, aren't you?
We will do all that we can to make best use of that facility. Right now, if the question is, are we going to put homeless people there? No. I think that's unfortunately, no, we're not.
Let's go to Ron.
Hi, I'm Robin Callahan. I work at a specialty clinic. That's my address. Okay. My question is this. So if we're closing long-term care, home health and hospice, what's next? What's the next part? Because I know from where I sit in my desk every day, since I learned disclosure.
It's okay.
April, it's been real hard to go to work because I don't know if I'm gonna have a job tomorrow. That's how it is. I know what the surgery schedule looks like. I know what the referrals coming in look like. And I know how many travelers work down in surgery. They're bleeding us dry.
That's right. That's right.
Yes.
So Robin, to answer your question, and all of you that are here, I see Joey here, who used to be in our finance department, he now works at the school. Congratulations. I just want you to know that it was recommended to me that we close long-term care a year ago.
That was not recommended by me.
That's not Joey's. Joey doesn't make those decisions, didn't make those decisions. But this loss has not been new.
So if it was recommended a year ago, why are we just hearing about it now?
Right?
Why didn't you tell people to go to the legislature a year ago?
We did.
Why didn't you open this one house?
We have been talking to the legislature. We have been trying to get other people to help us figure out how to...
But you kept it quiet from everybody. That's pretty good sense.
That doesn't make any sense. Nobody's heard in the paper on the radio. Come to the meetings, give suggestions.
Go ahead and hide from us. Is that what you want to do?
So I think that when
Let's let Robin finish her questions. If you have all good questions and comments, but please, there's a lot of people who've been waiting patiently in line. It's not fair to them if you blurt out questions, even really good questions or comments. Let's
So what is next? What's the next closure?
So we hope that this will be it. There may be other. I'm not sure.
Thank you.
Because I know that I've been told I will be absorbed to another department already. Thank you.
Okay, I'm back. I'm Cindy Lane. And I had another experience down there. And if you're going to generate money, to me it sounds like you need to get your computer system fixed to where you're billing, right? Another thing you have to do is, I know your coders need to communicate with the billers and need to communicate with your doctors to get the correct reimbursements.
Yes.
We get it all the time. I fell and broke my arms a year ago. I lived by myself. I had no help. I couldn't wipe my butt. And that nurse at hospice, home health hospice, did not even evaluate me. So how would she know what my needs were? And evaluations are paid for. And if I got treated that way, how many other people did not get their evaluations? But that is a billing problem. That's mismanagement. And then she needs to communicate with her doctors. I had 3 doctors write orders for me. If the orders weren't written correctly, those doctors can change those orders. It's her job to say, this isn't going to be paid for, but we can get this paid for. And those doctors have the right to change their orders to accommodate, to take care of these patients. I know it because I did do billing for 30 years, not just this facility. I billed other facilities all over. And you have to communicate with your doctors, you have to communicate with your medical records for the coding. Because one little code can change the whole reimbursement. And it's very important that that's done. And my understanding is that there's been 3 computer systems bought just since Charlie's been here. And it seems like we still have the same billing problems. So, and that's way to generate money.
You say it's management?
Pretty much.
Do you need a response? Do you have a question?
No, my personal opinion is I moved away from here for 15 years. I came back, I could see a big change in this hospital. It's not even friendly to go down there some days. You don't even get a hello, how are you, can I help you in the hallway anymore. A lot of people don't do that. We used to have auxiliary that was there to greet people at the front door, and they helped people. And they transported patients from facility to facility, which took away from having a staff member do this. It gets paid really high. The other thing is, I know a lot of people have the same question. How many houses did we buy for all these traveling nurses to stay?
Yeah.
We have if they could have stayed in those rooms, a lot of places have to stay in the residence areas. We used to have 2 mobile homes down there that they stayed in. And then you went and bought housing for them. That's expensive. It comes back to the tax. Yeah, I'd like you to respond.
There are a lot of comments that you've made. I'd like to address a couple things. First off, we have not bought 3 systems. We've had 2. We did have a fabulous system that was developed by one of our residents here. And it worked like a champ. Except it wasn't a medical record system, it was a billing system. And we needed to bring that up. And then we changed to CERN. That's the 2 systems that we have since I've been here. In terms of buying houses, a lot of people say, oh my goodness, you're buying houses.
Yeah.
Well, we have 3 houses. They are located right next to the campus. And they are used predominantly by physicians that are coming here that, as Robin talked about, when we have those specialists here, that's where they stay. We try really hard to get specialists here. And yes, the staff that's in long-term, are in surgery, there's a lot of specialists that are travelers, isn't there, Robin? That's expensive, and it's really difficult to do, but we're having a hard time doing it. We have some employed nurses, but we have some travelers. When it comes to why do we have those houses, we bought them for the purpose of, as part of recruiting. If we could get a doctor to come here, we would give them an opportunity to buy it. Right now, do you know how many houses are available that a doctor, if they wanted to come here, would buy? Hard to find. That's the reason we did it. In terms of your individual health care, we're not going to talk about that here. And I'm not, but I'm
Well, I
happy
did
to
come
talk.
to the board back then,
I understand.
and I know you backed the nurse.
Let's let the next speaker.
Okay, that's fine.
Hi, my name is Carolyn Niven, and this makes me nervous, so I hope there's a doctor in the house. This is going to take a second for it to make sense to you, but you guys keep talking about nobody wanting to move here. Well, I can honestly say I wouldn't want to move here either. There's nothing left, it's dying. My dad told me on my deathbed that I would see this town become a ghost town, and I believe it. So today, I'm trying to make, okay, we want people to come here, let's entice them, let's get some economy. I worked programs for 12 years. You get nothing for free that the government don't own, and it never lasts. I did funding for them, trying to get them here, and by the way, this is short, I got kicked off Facebook today. Because I went to Burns, Oregon. Wow, I put a shout out to Burns, Oregon, so cleaned up, 4 grocery stores, lots of businesses and restaurants open, small town friendliness with places to get your needs and lots to give. Is there any way for Lakeview to figure this out? Come on, let's do this instead of everyone moving. I'm from a really strong logging, ranching family. We worked. We had to work our fingers to the bone to get where we got. You gotta work, you gotta bring economy in, we need money. If you want your town to be lovely and pretty, it takes money. It doesn't take government money. We have the best nursing home in Oregon. And believe me, I know. My grandma died in another one, and I watched another kid die in another one, because they weren't being taken care of. We have it great here, let's work. Let's get this place going. What are we gonna do? Throw the backbone of the community, which is our elders, that worked and worked on ranches and mills and logging to make this town a lovely town 20 years ago. And now we're going to throw our seniors on the street, and you're going to put a bunch of homeless people in my backyard. Do you guys know if I go home tonight and somebody's sleeping in a sleeping bag, I can't kick them out? They can be out there shooting up, they can be out there molesting kids, and I can't kick them out. If I'm gone for a week and they pitched a tent, they can live in my yard. But we're going to bring homeless people, because we don't have any, believe it or not. We're going to bring homeless people here from Portland with bad ideas for our children, teaching them things. Our little boys are so impressionable. I know a guy and a whole bunch of guys here in town that ran for their dugout one day and somebody had blew their head off in there. Can you imagine? He will come speak, because I'm going to make him. We're going to have to put 20 feet fences up out there to keep our kids safe and not hurt. They're going to be walking up and down the streets, stripping everybody up. But we're going to make homeless housing for them. I give them my money. I'm a hard-working person.
This meeting is about the hospital's decisions, and I think you're talking about the topic that was here
I know
last
I'm supposed to be
night.
here last night, but my meeting goes deeper than that. We don't need this free money for any of this stuff. If we will get some people to move here, let's get the town going. My God, have you guys been to Burns? Applebee's, 4 grocery stores. That town was dying when I was in high school, and Lakeview was booming. We got it. My point is, let's get some economy here, and maybe we can save our hospital. We have to have people here with money and insurance.
Hey everyone, can you hear me okay? No. I have a very soft voice, so I'll try to speak up.
Right into, yeah.
Right into it. Is that better? Yeah. Now we're cooking with gas. All right. My name is Dee Tate. I actually live in Paisley. I live at 616 Mill Street. And I'm a relative newcomer. I'm also what's called an end-of-life doula. Does anyone here know what that is?
Yes.
Yes. Okay. Does anyone know what a birth doula is? Yes. Okay, so I basically was a birth doula for 20 years, and then I basically transitioned to the other end of life, and now I help people with end of life matters. It's kind of like a bridge between palliative and hospice care. Okay, we tend to be people who navigate systems for dying people and their loved ones. So we are the people that help bother the hospital billing department about codes, things like that. I'm here today because before I even came here, I was working with a woman named Cynthia Chimenti, who runs not an agency, not a caregiving agency, but a referral system called Circle of Care Caregiving. And she works with rural communities from Roseburg on up past Portland. And she had been looking at expanding into Southern Oregon. And when I heard about the closure, I said to Cynthia, it's time. We have people that really are going to need jobs, and there are a lot of people that are going to need care. And it may be that right now we only have 27 people who are receiving care. But the fact of the matter is that we have an entire population of people who are getting older and who are going to need that care more and more and more. Okay? Yeah. And so I actually am here today just to let you know that I exist. I'm here in the area. And we are looking for people to partner with. We're looking for businesses to partner with. We're looking for people who want to come be caregivers. There is a wonderful caregiving training program through Oregon Care Partners that we recommend. Okay? And then, yeah, I guess maybe the thing is I would just love for people to come find me if they're interested in any of that. And additionally, we're talking about money, right? We're talking about how we don't necessarily want state funding for things. Our quandary is who here does have funding to help programs kind of like mine and any other program, hospice related, long-term care related. So our question for the community is, are there community members who would be willing to put their money to work, right? To help and to create a board and possibly even purchase, like right now on L Street across the way from the soccer field, there is a 5-bedroom, 3-bedroom house that's available for purchase that wouldn't take much to become ADA compliant. It really wouldn't be anything like $1 to $5 million. It would be a lot less than that. So, we're looking for people who might be willing to work with us to make that purchase or would like to make that purchase and have us help them. There are lots of ways that this can look. And like I said, I'm a relative newcomer. I'm not a Lakeview native, but I see a lot of you wanting to work together to create a solution. And I just want to say that we're here to help in whatever way you see fit. Okay, so if you want to get hold of me, please do. And yeah, that's it. Okay, thank you very much.
Hi, for those of you that don't know me, I'm Rod Perry, live out there on Highway 395. I want to start with a comment. Charlie mentioned that the legislature is what we really need to bail us out and such, and it sounds like we saw this coming for a year or better, or at least people up here. I think a lot of the problem with this community is, myself included, I was blissfully naive until about a week ago. And if you know anything about the legislature, numbers are important. The more people screaming at them, the more progress you make. And so for the future, you got to realize you got a very experienced community here. You can tell by the number of people that are here. And if you get some of us involved and let us know what's going on, you might have a little better luck dealing with the state. That's just a comment, no question. I heard Price said 850,000, if I'm not mistaken. You did 1.23 million in a grant. That leaves you $383,000 for a remodel. And from what I'm hearing, that won't remodel the place. You don't have good projections to the remodel, at least not that I heard when you were speaking. How do we know that this isn't another big drain on the hospital financially? That we're gonna have
So, what I said was, it's a $1.2 million grant. We have $800,000 to work on a building. We were able to secure purchasing the building for $240,000. We have $400,000 estimate to fix the roof, and the rest would be used to fix the ground floor, the walk-in part, not the second floor, so that we could use it for that drop-in walk-in center. That's the initial grant. Now, the legislature just finished up on Sunday, and they allocated additional money, we don't know exactly how much that is, toward maintaining and improving and providing the service. So does that answer your question?
No. Can you buy and remodel that building for what you're going to get out of this grant?
No.
Yes or no? No.
We don't intend.
Where will the rest of the money come from? We can't pay for long-term care. Why are we taking on another project we can't afford?
So to answer your question again, we have no intention of remodeling the entire building. None.
I'm just talking about whatever you're going to do. Can you do it with the grants?
We believe we can, yes.
We can. And then the building will produce income to turn the lights on and pay the maintenance. I mean, it's great to get a grant to put a building up, but I got a building, and I got the same problem. I've had trouble getting doctors. I'm short-staffed right now. All these problems you guys are talking about, I've been there and done that, trying to keep my little business going. So I fully understand what's going on, but I also know, I gotta draw limits on what I can take people to. I mean, I can't take 3 times the going rate and be able to be fair with my clients and the community. And I think, if we make bad financial decisions, we got to figure out how to fix this. Okay, where do we hire these people? Where can we get them? Can we train them? What can we do? Is there any government programs to help bring nurses in or bring doctors into rural areas? I mean, the USDA has a program to pay back some student loans if you come work in a rural area for at least 5 years, if you have a doctor or veterinarian shortage and stuff. Is there anything like that that's being explored at all?
Absolutely. What you talk about that's available for veterinary medicine is absolutely available for the medical world. Right now, the doctor lives here, they get tax credits, they get ability to get some of their loans paid for. So people understand how much a doctor owes a lot of times when they finish medical school. When they finish veterinary medical school, I'm sure it's not cheap. But a doctor can easily owe $300,000, $400,000, and $500,000 in student loans. And I don't care if Biden approves waiving those, they still owe a lot of money. And we have been helping every one of our doctors that we try to encourage to come. So we do everything we can to encourage them to come. We do have that available. We also are, not everyone knows this unless you've been going to our board meetings, we have had some incredible donations anonymously. And we now have a foundation for continuing education for people that are interested in the healthcare field. They have to make some commitment to work at the health district. But money is a lot of money in there to help, like the Collins McDonald Foundation. It's close to $1 million for educational purposes. We have another program with $100,000 that we use to help pay for students that want to be nurses, that want to do a variety of different healthcare jobs. So we are busy trying to not only use local money, but federal and state funds to do it. Absolutely. Thank you.
So before you start, so we're just about at 8 o'clock, which was the allotted time for the meeting. I understand that you're willing to go a little bit more, maybe say 15 minutes or so. So yeah, if you can, try and keep your comments very short and questions easy to be answered so more people get to speak.
Okay, I'll do my best. My name is Jeanette Grant. I live at 3044 South F Street. My purpose tonight is a little more short-term. It's a little more imminent. I have a mother who has resided here since they were built. She's going to be 97. I got the notice that they were closing from a friend in Portland who said, "Are they closing the facility?" I said, "No, that's a bunch of baloney." It was true. I got a phone call from the facility Friday, a little over a week ago. It's basically the announcement made. It said, as soon as possible. Meetings with the nursing home, social workers, it was 30 days. Since that time, there's been no assistance, no plan to help, no, how do you navigate that? I haven't told my mother because I'm thinking, how do you tell someone big changes are coming, you're not going to live here anymore, I don't know where you're going to live or how you're going to get here, but just prepare yourself. I think the presentation, the approach to families and their loved ones could have been done so much differently. I don't want to leave without giving a shout out to the staff of the long-term care. I have been able to drop in any time I need to see my mother. They can call me, I can dash over. And I'm ashamed I didn't mention this months ago. There were so many travelers. And I think, Charlie, you said that the travelers cost 2 or 3 times more than a local person. I used to think, what if just a portion of that salary that's paid for travelers went to the staff who live here, who are committed here, responsibility for never asking that. But I'm asking now, wouldn't that have been a way to sustain employees? Everybody needed a job in COVID. Everybody needs a job now. Recognize the people who have a commitment to this community. And then I was surprised because when I heard on Friday, I got on the phone and called every U.S. senator, every U.S. representative, every state senator. I called the newspapers, I called the radio station, not radio station, sorry, TV station. I was shocked and did not know about this. And I'd like to know when this became an emergency, when were those legislators and government people who have the money, they have the appropriations money. $2 million, that's nothing to Washington, D.C. When were those contacts made?
Can I answer that? Or do you want to keep talking?
No.
Oh, I won't keep talking, I can be quiet.
No, I didn't mean, I was just, I didn't know you were finished. So a couple things. The folks in the legislators in Washington, D.C., those are federal programs. These are
So
state
it's
legislators.
Medicare and Medicaid. Those are federal programs.
So long-term care is paid for by state dollars. So it's state legislators. And we've been talking to them for the last year.
I'll tell you something, if you know if it's true or not. This is a conversation I had with Representative Bowling staff. They said that he had been talked with a month ago. And when they had just found out when I called, they were closing, they said they had no idea how urgent the situation was. And if that had been communicated sooner, there would have been, especially with the session's over. If they had known sooner, that they would have been working on it to get that money. So I don't know, it's frustrating. And I agree with Dr. Perry. If you had gotten the passion from all these people started, we could have bombarded the people that you have the money. What I'm saying is about, I'm getting that has nothing to do with the hospital, but I don't, what's the definition of safe and sober environment? And I think one of the things that's caused this problem, and people are concerned about with that, is there a plan for sustainability? Just because you get it, how are you going to keep it? So, but my main question was, what's the definition of a safe and sober environment that grants can go for? Is that right?
Martha, let me answer that.
So the question was, if I understand this correctly, what is a safe and sober environment?
What is that definition that has to be applied when you use that grant?
So we need to provide space where people that want to be safe, want to be sober. Safe.
Live there or become for tenants, or what does that mean?
Are you talking
about long-term care?
No, this is not long-term care. A safe and sober environment. This is not a house.
Is it
a drop-in center.
Isn't there already a drop-in center?
Yes, there is.
Yes, there is.
It's a temporary center. It's only there temporarily. We need a permanent location for us.
What makes it temporary?
Because we don't have a permanent location.
It cannot accommodate more than 2 or 3 people. It is temporary until we have a space that can accommodate group sessions and opportunities for people that struggle. Now, all of you here, I'm sure no one has any addiction problems or doesn't know anybody that has those problems, but if you do, many of you know the tragedies that happen with addiction. And part of the contract, this is a county responsibility, is that we provide those spaces. So the county is responsible for it. We're under contract to do it.
One more thing. No, this is good. This is for Charlotte. And that is, you know, my husband passed away in 2020, the height of COVID. I will never forget the hospital allowed me, my children, and friends to come and see Joe during his last days.
My name's Lori Singleton. I live at 102 North J. So first, I have a question. What is the projected annual cost to maintain the empty building?
I haven't calculated that, but because it has geothermal heat, and we already purchased that heat, we'll be able to maintain the heat of the building. So I can't exactly say how much the lights or, because we at least maintain. Oh, wait a minute, Don, you have a question?
$88,954 for utilities.
How much?
Say it again, Bob, please.
$954 for utilities.
But not
Question for utilities is $88,954 annually.
That's what it was for.
Operating.
That's utilities for the gardens.
Operating. But what about, she's asking about empty.
Probably still about the same, I would imagine.
The other question I I had, Jeanette actually asked and it wasn't answered, is with our long-term care staff that are local staff members. I know I was one at one time. And the travelers made 3 times, 4 times what we did. And we were told by multiple times that if we didn't like what we were getting paid, we could go travel. Why didn't you give that money to our local people, to keep our local people?
Let me answer that by saying, we didn't pay the travelers that amount of money. That money went to the companies. And in case anybody didn't know, the profit margin of those traveling agency companies went from, for the big ones, they made $1 million the first year, and during COVID they made $20 million or $30 million. That money didn't go to the travelers. Frankly, we don't know. They didn't tell us. Maybe they told some of the staff how much money they got paid. But we were not able to know.
I can tell you from working with them alongside them, that they were making 2 to 3 times what we were making, doing the same job or less, because they didn't care about our people. They only cared about the paycheck.
You know, one of the tragedies that we're seeing in the industry of nursing, thank you for your question, is that you know, one of the problems that we're facing in nursing is we're not producing enough nurses. Too many of our nurses are retiring. And those that are coming out, 10% quit. This is on a national basis. 10% quit in the first year. The work is hard. It's challenging. They don't want to do it. Not only that, new graduates, 10% are becoming travelers. They're not even going to work in a community. So it's changing. Our workforce is changing. And we're experiencing it.
Mike Trumpet, 420 Southeast Street. So I just got a couple of comments. First comment is, one, you're public, and you're not a private entity. Should have been open and honest about this a year ago when you knew about it. You said Poland about the fact, and I was just finding about it now. That's just a comment. Second comment. So I was the CB for 13 years. Anybody know what CBs are?
Yes.
Civil engineering. I can tell you straight up that you should not believe any word coming out of engineers' mouth when it comes to remodel. It's going to cost you a heck of a lot more than what they're telling you. Stop asking these years. Anybody that's in project management, such as myself, will tell you the number's wrong. You're not going to be able to afford that. You can't afford it. It's a pipe dream. That's it.
Can everybody hear me? Yes. Okay, I'm Barb. I am a recovering addict. I've been in recovery for 25 years. Quit using us as an excuse. I am fed up with the babying of active addicts. I didn't get clean and sober by people babying me. I got clean and sober with the law hanging on my back. I got clean and sober because my life was in danger. I was about ready to die. I got clean and sober because people quit enabling me. That's how I got clean and sober. And I went out and I worked my ass off for my recovery. I worked it hard. I did volunteer recovery in this community, which thanks to the hospital, you guys stepped on our toes. So that we can't do anything now. So I am sick of that excuse. That is another money maker. And that's not what recovery is about. We are not out to make money. We are here to help people who want to get clean and sober. That's all I got. And every single one of you should be ashamed.
Can you hear me?
Yes, girl.
I'm Sandra Watts, and I'm no relation to Debbie Watts. I'm the mean one, she's the mean one. I want you to know that I was born at that's now been torn down. Gerald, I think you were born at the hospital, right?
Correct.
Debbie was born at the old hospital, now the senior center. So I go back a long way in this community, as do my ancestors, 5th generation from here. And I mistakenly went off to law school, which was a big mistake, because I don't understand what you've done here. You said you had a working session. Do you consider that a special session or an executive session? Did you make this decision in a working session? Did you make this decision at a...
Working sessions, we discuss all sorts of...
I understand that, but what I'm getting at is notice. You have to give in either an executive session or a regular session, have to give notice about what your subject matter is going to be. Had you done that, all these people wouldn't be here tonight, they would have been there then. Nobody knew about it. No public input before the decision, and that's several people have said that. Had, I think Dr. Ferry and others, had we put our heads together, we could have helped you. What were you doing for 4 years, some of you who've been on your time? And the houses that are over there now, as I understand that with long-term care facilities, they must be with a hospital or with a medical facility. Is that correct? No? No. You're Shireen shaking her head no.
They don't need to be with a hospital.
Okay, so you could rent out the 3 buildings that you have there to somebody else to continue on with long-term care?
Yes.
You can do that.
That is a feasibility.
Are you willing to do that, or do you need to talk about doing that so that we can keep Jeanette's mother here?
So to answer that question, we would have to have state approval for that. Is that something that's... Why?
Well, it's an emergency.
So why is that? Let me explain. We are licensed by the state. If we don't follow state rules and regulations, they take away the license. The facility is licensed. If we want to consider, it's a wonderful option to have maybe a foster home, something to that effect. We would have to have state approval. Now, can we get that? I don't know the answer.
Because you have to have state approval. I'm bad at interrupting, but I've only got a few minutes. And he's so you have to have approval because this was done with state money. Is that correct?
No.
The houses were built with what money?
So the houses are licensed by the state.
I understand that.
So the license to operate a long-term care facility, the license to operate a foster care facility is granted by the state. It is not something you can choose to do.
I understand that you have to have the right medical people there, but let me ask you something. If these 3 houses, there was an emergency request to the state, not everything with government takes a long time, there would be emergency requests because of this particular situation, and they granted you the ability to lease those houses out to a licensed entity. Would you consider doing that to keep people here? Okay. All right. Okay. Second, on the Hereford house, I mean, when I was a little girl, I was in the Hereford house, in the Hereford building, and it was a wonderful building. It's not so wonderful anymore, you know. And if you only knew the first floor, you're gonna have the third and second floors caving in on you. So it doesn't, right now, it just doesn't make sense. You do not have to take the $1 million grant or whatever it is. You can turn it back. I've understood that your administration is top-heavy. Would that be a possibility of cutting down on the administration? There's Medicare beds for therapy, as you know, and they're money makers. It's not Medicaid, it's Medicare. I was the head of a Medicare fraud unit in New Mexico. They're Medicare beds for therapy that make money. Do you have Medicare beds in those 3 houses? Yes.
So, are you asking about swing beds?
No, I'm talking about beds that are specially for Medicare, where somebody gets an operation, goes in, has to have therapy.
So, one of the programs that we have within the critical access hospital rules and regulations is called a swing bed. And that is where a Medicare recipient who has a surgical procedure or has something done, they can be admitted into the hospital as what's called a swing bed.
And Medicare will pay.
Medicare will pay.
Okay, that's what I was talking about.
And they can stay for 99 days in the hospital if they qualify.
Okay.
And there are rules and regulations
You're
about that.
taking up my time, so I understand
Your time is already expired.
The political...
Please, be fair, look at the next.
Oh, I will, I'm sorry.
You're well over 5 minutes now.
Okay, I wanted to tell you, elections have consequences. And Mr. Tweet, the reason that you couldn't get a hold of the legislature for 6 weeks is because your party, all of your party, left for 6 weeks. That's why. So elections have consequences.
Hold on a second.
Okay, that's why I was stopping.
Yeah.
Let's make this the last comment until past 8 o'clock.
So we have 10 minutes. Let's try and have 3 more speakers, okay?
All right. My name is Tony Bitter. I'm actually married into a long-term family here. My mother-in-law's over here long-term. There's a lot of things that thankfully everyone's been covering. One of the things that came up, the hospital does own multiple properties, commercial and residential. Are they making money off of those, or is some property management taking the lion's share of that? Just one of the things, and the other one is, I've heard that somebody's willing to buy those houses. You're telling us they're not for sale. The 3 long-term care houses.
Yeah, that's right.
So, a couple things. We don't make money off, we didn't buy the buildings to make money. We bought the buildings that are houses for physicians that are traveling here to work. Or if we had nurses, we would use that for them. And again, the purpose was if we could recruit a physician, they would buy it from the district. That was the purpose. They're close, and that was the reason for it. So we're not trying to make money. And yes, I'm sure many people would want to buy it. They're nice houses. So they go up and down. They're not like we're wasting the money. We're using it for people that are coming here to provide service. Does that answer your question?
Yep. So, was there an offer on the table for the other buildings? Just that out of long-term care buildings?
Was there an offer to purchase the long-term care?
Yeah, there's been, like you, one person tells one person, you know the situation around here. Has there been an offer for somebody to come in and buy those?
No.
There's never been an offer. So, because a year ago, if we had known about this coming up, imminent closing, a year later, more could have been done. So that's why I'm asking this question now, because 6 months from now, nobody wants to hear that, oh, we decided to sell it. That's why I'm asking, so you can be straightforward and honest.
So, a lot of people have said, oh gee, why didn't you just sell it? So you have to think about who wants to buy. You know, if you want to sell something, you want to figure out who's going to buy it. So when we think about anybody that would want to buy a long-term care facility, long-term care facilities generally will make money if they have over 150 residents. When they're small, they can't survive. And we have been supporting that over the years because it has never made money. So if anybody wanted to buy it, typically those investors that would buy it are trying to put together proof of a business, buy several, and then sell that to another investor. And the worry would be that if we were to sell them, in 2 or 3 years, we would have somebody owning a building that they would close down. And then it would not benefit the community. Okay. And that's the reason there has never been.
Tony, you forgot my question.
That was your question.
No, on the side.
Oh yeah, she wants to know why you opened the Plum House 3 months ago, or April, May, June, yeah, 3 months ago. The Plum House was open, the one in the middle. That was open at the beginning of April, and that's when my mother-in-law went into it. That's.
So when we opened up the middle house, the reason we did that is we were pretty confident that we would have enough staff. Staff that were here, nurses that could work here, CNAs that could work here. And then people that we relied on, that's it. Okay. And we had to rely on travelers. We did not have enough staff. That's the hard part about it. I wish there was a better solution, but that's the reality.
Well, Eric, I live right over here. 2 things. Was long-term profitable before we built 3 new buildings for no reason?
The answer is no.
Was it closer?
No.
No.
So one of the things that a lot of people say, well, why did you build new ones? And here's the answer. Anybody that had been in a long-term care facility that is attached to the hospital would know that when we remodeled and built the hospital, we had to change out all of the heating and air conditioning because it didn't work. Some of the rooms were hot, some of the rooms were cold. If anybody doesn't remember, that was a reality. Next, for us to remodel a building while people were in, we'd have to move them out. You couldn't do it at the same time. Third, the building itself, that courtyard that is so beautiful, anybody notice how it sunk? When it was built back in the 70s, they didn't put enough fill. So the state was busy, ready to close us down because it was unsafe to go outside through the sliding doors. We would have had to tear everything out in the middle and bring up the soil so that it would be level and then redo all the concrete. And based on that, the cost to remodel it would have exceeded the cost to build it. That's the reason.
My last one is, you were talking about how hard it is to get people here. If you do shut down, what are you doing to retain these people that are currently working? Are you offering them jobs, or are they going to be able to transfer? Or are you just making them apply for some new position with no more seniority, no more?
So, are you finished? I didn't mean to interrupt. So the answer for that is the employees are either represented by the Teamsters or represented by the Oregon Association. And we follow all of the union guidelines. So seniority plays into that, skill set plays into it. So are we doing all that we can to help our employees? Yes. Are we following the union guidelines? Unquestionably. There's no question about it.
So if you lay these people off, they're gonna end up with their long-term bank and their PTO and all that stuff that they've worked for many, many years for.
Absolutely. But the thing to keep in mind, all Teamster employees, not everybody knows this, but Teamsters have the responsibility and opportunity to find them other jobs where Teamsters work. That's what the benefit of a union is.
Yeah, you have the honor and the opportunity to be our last speaker. We're almost 8:30 now.
Can you hear me now? Okay. I'm Shirley Smith. I live at 907 North 7th Street. I am here tonight so that you will see one more resident present. I do not have any expectations that anything will be redirected by what we have to say or what we have or how we feel. Obviously, the hospital finances were like a car at the top of a steep hill, gaining speed, and no one in the driver's seat had the presence of mind to apply the brakes until it was too late to avoid disaster. I hear roads for our family and neighbors are being thought as far away as Portland. Obviously, it's clear that all of those facilities that are top-notch or even standard are going to be full. And we're going to be pushing our seniors, our friends, our families into substandard facilities. And I think it is horrible. That's it.
People that want to still talk by shutting off the meeting.
It's up to the board.
How about you?
No, it's up to us. We want to speak.
The last three to speak, okay?
Hi. Can you hear me? Yes. I'm Michelle Cox. I live on Birch Street, which is just behind the hospital. I think that the biggest problem we're having here tonight is lack of communication. I agree that if you would have told us if there was an issue, we would have gotten pissed off way sooner and we would have showed up and made something happen. I mean, it happened with the prison, and I think as community members, our butts should have been at some board meetings. Lack of communication, and here we are at the final hour with no solution. So my question to you guys is, sorry, I have a tickle. What can we do as a community to help to bring this back?
I think probably the best question, that is an excellent question, and that is bother every one of our legislators, especially the ones that don't listen to us, the ones that have that D behind us. Okay. So remember, we're in Republican country.
That's not working together.
The Republican country part that says we want to get something done. But the people that are making the decisions are not on our side.
That's bad.
You don't think so?
No.
Well, then I encourage all of our Republicans, get after your Republican representatives, because they will make the difference in our great state. They stood up by not going to sessions.
I don't think we ought to be making this Republican Democrat.
So, as a layman on the street, is there a way to share publicly with, like, who to contact and what we should say? I mean, with the prison, you know, we have guidance, we have Jane telling us, call this person, say this, write a letter and say this. I mean, not everyone here is well versed on, you know, politics, things like that. But if directed and advised, maybe we could help.
Could we have something put in the newspaper, how to contact your representative?
It's in the newspaper.
Yeah.
Not all of us in the newspaper.
And as a community member, I will make a commitment to try to come to more meetings. It's difficult though. We have so many boards and so many things that we volunteer our time for. So it's difficult, but I would encourage everyone else. I have been to a couple of hospital board meetings. I will admit it was usually because something that was important to me was on the agenda. And there wasn't a crowd, so we'll show up. So share with us, tell us the information.
Lori Kroger, and I live at 316 Mountain View. I think you can all hear me, and I hope you can. I have really pondered this because I've had 3 people in my family in long-term care since we've been in Lakeview. We were a private pay. Now, everybody keeps talking about just Medicare or Medicaid or whatever it is. Well, I'm here to tell you, you know, the staff does not make any differentiation between private pay and Medicaid or Medicaid. But I know there's a difference in the fee. So I'd like for that to get cleared up with the public, that it's just not a Medicaid problem. The other thing is that I feel in the last week, what I have heard, and I need to share this with you, that this is tantamount to elder abuse. Because what you have said to the community is, we don't want you here anymore, and if you become ill and have to go into a swing bed situation, we don't have any place for you. So where will these people go? You need home help. How are you going to provide that? Hospice. I work with people all the time who volunteer. I have people who need hospice, who have to be in palliative care. So what are we going to do with that? And as I understand it, I don't understand everything about the board that runs the long-term care and Goose Lake, whatever it is, medical. But I think that home health and hospice is still owned by the hospital. So did we contact Klamath Falls to see if they would like to satellite over here? We need home health and hospice. What are we going to do? I mean, I'm getting old. There will be no place for me. Okay? There will be no place for the majority of these guys and their loved ones. So what do you plan to do? Is there any way that we can hang on to home health and hospice? Have you explored asking people to come and make a satellite? Have you advertised, hey, we've got a long-term care facility for sale? Have you done that? No. I mean, I'm asking the question because I'm a problem solver and I would like to know so that people, the elderly in this community are frightened. They are extremely scared. There are people who have people, their loved ones in long-term care that still have not received a written notice that they're closing the gardens. Now, that's an organizational problem. But before you start kicking people out, what are we going to do about the people who are terminal? Are we going to provide beds in the hospital for them? I think you should think about this. Because how are you going to transport them? And then the people who were in long-term care, they go to Portland, who's going to pay to bring them back to be cremated when they die? You know, the families, a lot of the families that have loved ones in long-term care cannot afford these expenses. So there's so much that needs to be answered. And I just think there's a way to put a halt on some of this until you explore it. It takes a village to raise a child. It really does. But it also takes a village to care for our elderly people. And when we and you're all good people. And I don't think that you really want to have that message that we do not care about people who are at the end of life. I don't think that's your intention at all. But that is the impression that is coming forward. So what do people do? You want to build a town, but please, if you're elderly, don't come here, there will not be services. And I feel sorry for the doctors who have to try and find places for the people to go. What are you going to do about doctors for these people? And has that been explored? Do you have any answers?
I think these are all good questions, and my answer is no, but I think there are some things we can still look into to see.
Pardon?
My answer is no, some of those things have not been looked into, but I think you raised some very good points, and there are some things we should look into to see how we can transition this to make it best for everyone, so.
Well, I do
think
too,
it's a good
John,
point.
and the thing of it is, I just think there needs to be a halt put on this. Because people found out on social media about all of this.
Yeah.
Before they were ever notified as a family. And some people still have not been notified. Everybody does not have a cell phone. All the communities, we've got Adele, we've got Fleisch, we've got all the people around, we've got, Prison Valley, we've got all the people up north. Some of them are just not getting the word through either the lowdown or the newspaper. And for most of the people here, I think the way that they found out about the meeting tonight was on Channel 12 over in Medford, which ran big, huge ads, and Charlie had an interview with him. That's how I found out about it. And so I have been on the phone, I'm going to be very upfront. I have talked to Berkeley's office, I have talked to Wayne's office, I have talked to Portland. I even invited some media from Portland to come down and attend the meeting this evening. I think we need to just put a pause on this and please involve the family directly, not by mail, but you all need to sit down with these families that are involved in long-term care and talk to them. They don't know what they're going to do. They're terribly frightened. And where are their financial assets going to come from in order to replace these? Does that make sense? Okay, I really thank you. Thank you.
Good evening, everybody. I'll try to make this brief. It's been a long time since I've spoken in public, so please excuse me any blunders. My name is Sam Snyder. I live here in Lakeview. I have for 5 years. I am not a Lakeview local, but I have a couple questions that may offer a couple solutions. I come from a county a lot like Lakeview in northern Oregon. In 2013, my grandmother was diagnosed terminal lung cancer. At 17 years old, I was a hospice volunteer that learned how to dose morphine for my dying grandmother because there was no hospice. But there was one critical access hospital near us in Heppner, Oregon. One thing they did when their home health and hospice had to close because the boom of the logging industry was done, the nurses rotated back into the hospital and went on rotations throughout the county as home health and hospice aides. They spent one of their shifts every week going home to home, helping state caregivers, helping people on Medicare, giving back to their community. Some people did this in volunteer time. They were a registered nurse. Is that a possibility for some of the employees that may not be able to transfer somewhere else in hospital in order to keep some form of care for our elders who have given us their entire lives? I've also had family in long-term care. Is there another state agency you could contact, Klamath, Bend, Portland, to do a satellite office to take over the license? Not so you lose the license, because I understand that's important for the hospital to keep to do anything like this in the future, but to transfer it so that our seniors can stay here, especially those that don't have family left. There's a few I know in long-term care right now here that as a vendor in some of your local shows I have met, they don't have family left. They have nowhere to go. You want to fix the problem of people having nowhere to live, but you're creating some. Is there going to be outreach for them? There's one of my coworkers who had to take her husband home. She can't afford to pay for a home health care worker to come in. Is there going to be programs that you guys are going to look into for grants and funding? Because I know that is a thing in the state of Oregon for those programs, to help these people that have had to bring their senior or elderly people home, to help them care for them, to help them afford it, to make sure that there's no injuries, there's no mishaps, to continue giving them care. Is there any options like that that you've looked into at all? You've known this was a possibility for a year. Have you done any of the research for it?
You know, one of the things that you talk about is volunteerism. And isn't it wonderful if we have volunteers? Right, that is. If we could have volunteers to do that, it would be marvelous. In terms of us as a hospital providing visits in home, as a hospice or home health, does the State Department of Health and Human Services offer that? They do offer a variety of different things. And they do provide people with the ability to take their loved ones home and then help keep that loved one at home. Is that the best option? The state does make arrangements for that.
But the state is not perfect. I was a home health caregiver for 4 years. You have to meet income requirements. Your other spouse has to meet income requirements. You have to meet housing requirements. You have to meet condition requirements. For those that don't meet those requirements, are you going to look into programs, into creating one with grant money, and to even looking into creating a grant to help them with that? Are you going to help them with the resources to find it? Can you help them with the resources to find it? Because like so many have said, not everybody gets the paper. Not everybody has internet access. Some of our seniors are not technologically inclined enough to understand how to do that. Are you going to give them the help? If this is what you're going to do, if we can't stop it right now, if it has to be done, what are you offering to help them?
I guess the best answer to that is we will do all that we can to direct people to the health and human services that our state offers. And it's hard to find. Are there grants out there? We've looked, but we can keep looking. This is a difficult situation. We're not trying to make light of it. But our problem, no matter if we were to invite Klamath to come here, does anybody think that Klamath has a lot of nurses and a lot of people that want to work? They have a hard enough time delivering services in Klamath home, let alone. But we will certainly look and do the best we can.
Maybe they would come and
Please bring, this is the last thing I want to say, you bring this back to nurses every time, Carly. With every long-term care facility I've been.
Can't hear you, hon.
You bring this back to nurses every time. You are nurse heavy, and that is nothing against our amazing nurses. We have an amazing staff of nurses, travelers or not. But every long-term care facility that has been successful or that is not heavy on salary has nurses, has CNAs, has a med aid or two on shift, and has caregivers. You have an overabundance of caregivers in this town willing to work because they work through the state and not enough patients to sustain them. Have you guys thought about structuring it that way?
That's the end of the time that we have available. Thanks everybody for coming out.